after seeing my general dentist for my son. When he was first having his teeth come in, they were coming in with no enamel. So we were referred to Dr. Taiym. Dr. Taiym found out that he had a rare tooth disease, which caused the teeth to come in with no enamel. When Dr. Taiym was examining him, he also recommended that I talk to the pediatrician about obstructive sleep apnea, which was something that I had never really even heard of. But my son had been experiencing symptoms of sleep apnea since he came home, but the pediatrician just always told us that he was congested, or maybe he had a cold or something like that, and had put him on a nebulizer and different medications, or nasal sprays or things like that. So I talked to the pediatrician about the obstructive sleep apnea, and she referred us to an ENT who set up a sleep study for him. But the soonest that they could get him in was 6 months. And so we set it up. Probably about a month after seeing Dr. Taiym, his symptoms got extremely worse, and they continued to get worse to the point where I took him into the emergency room. Taking him into the emergency room, I talked to the doctor, the ER doctor on call, and she dismissed it as no big deal. It wasn't anything to worry about, that he would be okay, and proceeded to send us home. I argued with her to get her to take a second look, and come to find out he did have obstructive sleep apnea. He was 100% obstructed, and he ended up being hospitalized for over a week to get his tonsils and his adenoids taken out. The first night in the hospital, they were doing a sleep study, and 30 minutes into the sleep study, they stopped his sleep study to put him on oxygen, and they ended up having to put him on 6 liters of oxygen day and night because his oxygen levels were dropping to the 20s and the 30s when normal oxygen levels are supposed to stay at 100. And the doctors told me that he was not able to leave the hospital until he had the surgery. After having his surgery, the doctor at the ER came and told us that she was glad that I had argued with the ER doctor and had pushed to get him seen, because she told us not to scare us, but he wouldn't have made it the 6 months until the sleep study. So we would definitely recommend talking to your pediatrician if they're having any of the symptoms, even if you don't think that that's what it is, or even pushing the pediatrician or the doctors to do further testing if you really feel that they are having the symptoms, because seeing Dr. Taiym and pushing to have further testing honestly saved our son's life.